Good afternoon, everyone. And welcome to your Construction Safety Association of Manitoba's 2023 Safety and Health Week virtual webinar series. Safety and Health Week is a continent-wide event spanning the countries of Canada, USA, and Mexico. The goal of Safety and Health Week is to focus the attention of employers, employees, partners, and the public on the importance of preventing injury and illness in the workplace, at home, and in the community. My name is Megan Story, and I am the Training and Development Manager of the Construction and Safety Association Manitoba. We are proud to be recognized as your premier and trusted source for safety and health information, resources, training, and core certification. Today's Safety and Health Week virtual webinar is an example of how we are striving to provide you with practical and relevant information to help with accident prevention in your workplace. For those of you who know CSAM, quite simply, our answer is yes. How can we help? We will have the answers to your safety questions, or we will find the answer with the help of our qualified resources and partners in safety and health. Today, I am pleased to introduce Jordan Friesen, who will provide us with the practical strategies to help us identify and respond to employees who may be experiencing a mental health concern at work, as well as strategies for creating a psychologically healthy and safe work environment for everyone. Jordan, the screen is yours.
Thanks, Megan. Appreciate it. Thanks for having me here this week. I am really excited to be sharing what are hopefully some valuable insights with a number of interested construction folks. Again, my name is Jordan. I'm an occupational therapist by trade. I consult for organizations all across the country on workplace mental health. And I think what has stood out to me more over the last number of years is just how many different organizations are now concerned with this issue. Certainly over the course of the pandemic, we've seen a much stronger focus on mental health, mostly because many of us have experienced challenges with our mental health. And we're seeing that now emerge in the workplace. And so more organizations are taking this issue very seriously. And in particular, many organizations are taking it seriously from a safety lens, which is also really important. We know that, for example, when individuals are struggling with their mental health in the workplace, they are significantly more likely to cause near misses. They're also significantly more likely to cause critical incidents or significant safety hazards. And so not only is looking after the mental health of your people really good for them, really good for business, it also supports effective safety culture. And so that's why I'm really excited to be here and kind of marry these two topics. And as Megan said, our goal today is to give you some understanding of how, primarily as a leader, and whether that's a manager, supervisor, foreman in a workplace, how you can actually identify and respond when somebody might be struggling. And then, as Megan also said, how do we actually move towards creating a mentally healthier work environment for everyone, where work is less likely to cause challenges with our mental health? So give me a second here. I'm just going to tee up a few slides for us, and then we'll dive right in. Perfect. So as we go, I would invite you, certainly, if you have questions, feel free to throw questions in the Q&A function as we go. I'm not sure if everyone has access to the chat. If you do have access to the chat, I can also see it, so feel free to put questions or responses in there. I'm more than happy to take those at any time as we go. And of course, the more questions you have, the better our conversation here today. So the more you put in, the more you're likely to take out. So in terms of our objectives, I'll just restate them here briefly. Number one, we want to identify what exactly is, in this context, a manager's role, and think about manager as leader, supervisor, you name it, anyone with responsibility for other people in the workplace. What is their role in supporting employees, across the spectrum of mental health, and particularly when they're struggling? How can we recognize and respond to a mental health issue in the workplace? And I think that the nuance here is that I could teach you how to respond to someone experiencing a mental health challenge at home or in the grocery store, but in the workplace, there's different dynamics at play, right? We have work that needs to get done. If you happen to be a leader of any kind at any level in the workplace, you also know that you're responsible for getting work done. And so there's additional challenge there. How do we respond to somebody who's struggling, but also keep in mind the fact that we're in a workplace, there's responsibilities that each and every one of us have, and those aren't going away. We can't ignore them. And then finally, my hope is that you can walk away with at least a few ideas of some practical leadership strategies that promote good mental health or psychological health and safety in your teams. So ideally, before somebody experiences a challenge, what can you do to make sure the work environment is healthy and is psychologically safe for each person that enters it every day? And so maybe what I'll just suggest as we get rolling here, and the topic of the day, of course, is mental health. And we know that many people in the workplace, especially those in supervisory positions, do have a difficult time understanding or even thinking about approaching this issue. In particular, how do you approach somebody who might be struggling? And it's a common concern for anybody, again, in a supervisory position. And I guess really just to get us going, I'd love to get your thoughts and maybe your perspective. And so we'll do this as a fairly informal poll. Feel free to throw it in the chat if you like, or you can use the Q&A box, whichever is handy or easier to find on Zoom for you. But when you think about, for example, addressing a mental health issue with any one of your team members, what is or are the most pressing concerns, or what are the things that concern you most? So we've got a number of responses coming in on the chat: Sasha, Joelle, and a few others. Norman, thank you. I see a lot of people highlighting option C here, as well as a few people highlighting option D. Okay, so knowing what your boundaries are as a people leader, for example, in the workplace, right? So what is my job? What is not my job? What can I do? Perhaps even what can I say and not say? And then a number of you indicating D, so offering the right kind of support to somebody who's struggling, because you may not necessarily know what that looks like, or even at times how to get it. So as responses are coming in, I'll just say that no matter what you picked off of this list, you're certainly not alone. So this list actually comes from a few research studies that ask managers in workplaces this very question: what is your biggest concern? And all of these are incredibly common concerns. So whether it's how do you know when someone's struggling, how do you actually feel confident in asking about what they're going through or opening that conversation? How do you navigate those boundaries in a workplace in a way that feels comfortable and you don't always want to get too personal? And then again, the right support. And then I think fair to say that some of us may even be struggling ourselves. And it's hard to support others when we ourselves are struggling as well. So no matter what you picked here, know that you're not alone. Know that anything on this list is a common concern for just about any manager, supervisor, leader in any workplace. And all of these things are things that we're going to touch on today. So my hope is that if these are significant concerns for you, while I won't promise a silver bullet in 45 to 50 minutes, my hope is that you can walk away with at least a little better knowledge or a little more confidence in addressing mental health issues within your team. So before we dive into how to do it, I do just want to spend a little bit of time talking about the why. And it is really significant and really important. And so, when we talk about mental health issues in the workplace generally, we can talk about it at a big population level. And so, for example, in Canada, poor mental health costs our economy about $50 billion a year, and that's expected to climb to well over $200 billion by 2040, provided we do nothing different. Now, my hope is, of course, that we do a few things different, and that's exactly why I'm doing the kind of work that I do. We can also boil that down to the cost of simply lost productivity, right? So poor mental health, 50 billion, that includes healthcare and all that kind of stuff. Just the cost in productivity to workplaces is estimated to be about $20 billion, okay? But when I talked about those numbers with most businesses, they're big, they're large, but it's hard to understand what that actually means to them. And so I like to talk about it then in the context of, say, like a 50 employee company. Okay. So in a 50 employee company, here's a few things to keep in mind. So let's go back to that cost question, first of all. So what is poor mental health already costing a workplace, a company of about 50 employees? Okay. Well, it turns out it's at least $54,000 every year. Right. And that's actually a US based stat. So take that, translate that into Canadian dollars. It's a little bit more. So well over 50,000. And that's just related to primarily absenteeism, so time away from work. Okay. We know that employees who are struggling with their mental health do take more time away from work, and they call it sick time, or they don't show up, or they quit, for that matter as well. The interesting thing is that actually we lose more from employees that show up to work unwell and still try to do their job. So employees that are coming to work and maybe not feeling 100%, we lose about 10 times that much money from employees at work not fully functioning. And we call that presenteeism. So I'm here, but I'm not fully here. Okay. So massive economic cost. Every year in a 50 employee company, on average, 10 employees, 10 out of 50 are going to experience a significant challenge with their mental health. And you've probably heard this number before. It's about 1 in 5 Canadians every year. Now, that doesn't mean they're going to go to their doctor and say, my doctor's diagnosed me with an anxiety disorder. It means they're going to experience some significant challenge. Now, that could be because of a really difficult life circumstance. That could be because of a really significant stress at work. That could be because they've been diagnosed with major depressive disorder or generalized anxiety disorder. Either way, it's impacting their performance in the workplace. So it's important for us to pay attention to. So about 1 in 5 or 10 in any given year. And then in terms of how much time away from work you could potentially expect in a workplace of about 50 employees, it's about 2,060 lost days. Okay. And so when we kind of look at that and combine both physical time away from work as well as that presenteeism aspect I talked about, being at work but not fully productive, in a 50 employee company every year, it equates to about 2,000 days. So it's a lot of time. And in the construction industry, I know time is absolutely money. So this is an incredibly important issue for us to be paying attention to. The other thing that's not listed here that I think is really worth mentioning is the unfortunate rates of suicide that we see certainly in Canada, in many communities, especially Northern and Indigenous communities as well. But we also see higher incidence of suicide actually in the construction industry. And this is a global phenomenon. So for example, in the United States, the construction and extraction industries combined had the highest male suicide rate. And this was from back in 2015. But the key point here is that it was about 3 times higher than the national average, 3 times higher in the construction industry than the national average. In Canada, we use some Canadian data, although not quite as much exists that's been collected here in Canada. Suicide and death by suicide is one of the top 10 causes of death. Men over 20 years old are at most risk, and that is many employees in the construction industry. We know that suicide rates are 3 times higher in men than women in Canada. And so this is not to say that we have every company is experiencing an epidemic of suicide, because I don't think that's necessarily the case, but important for us to pay attention to, and why this becomes so much more important in the construction industry. In many other industries and with many other populations, the end result of poor mental health might simply be leaving a job. But unfortunately, we know that poor mental health can result in different and more devastating consequences. And so this is not to scare anyone, but I think it's an important recognition that construction is an industry that faces unique challenges. And there's really important impetus to be paying attention to mental health within construction companies, within the construction workforce, because there's big opportunity literally for saving lives. And that's really important and I think really meaningful. So next, I'm going to talk a little bit about mental health, mental illness, and some of the terminology that is helpful for us to understand if we're going to talk about what our role is in supporting people. Okay, so again, this is sort of foundational information before we dive into exactly how you can support or exactly what you can be doing as potentially a leader in a construction company or in a construction field. So this is something called the mental health continuum. Excuse me. And this was developed here in Canada by an organization called the Mental Health Commission of Canada. The latest version they published was in 2017. It was originally adapted from Australia because I guess a lot of good things come from Australia. But essentially what the mental health continuum tells us is meant to describe is simply the fact that our mental health is on a continuum, okay? And you think, well, yeah, that's simple, Jordan. And to a degree it is, but let's break it down a little bit. Each of us would understand that our physical health is also on a continuum, right? Some days we feel physically healthier, some days we experience illness, right? Whether it's a cold, a flu, or something more serious like cancer. But we also all recognize that we aren't always at peak physical health, right? There are many things, many circumstances in our lives that maybe cause us to be less healthy than we would like to be. So for me, for example, I've got a toddler at home, and I can tell you that that significantly impacts my ability to be as healthy as I would like to be for a whole host of reasons, but primarily sleep deprivation. So all of us understand physical health continuum. We understand the ideal health state that we want, but we also recognize that sometimes we're ill and sometimes we're just simply less healthy or not as healthy as we would like to be. The same goes for our mental health, okay? So on the left-hand side of the screen, you have what we'll call the healthy zone, okay? So this is where your mood is stable, you feel calm, you're confident, your focus and concentration are good, you're active physically, you're engaged socially, you're sleeping well, all of those things where if I were to ask you, what does it mean to be mentally healthy? These are the kinds of things that you would probably say. On the right-hand side of the screen is the illness zone, or as I like to call it, the unmanaged illness zone. This is where a doctor, a psychologist, a psychiatrist, a mental health professional would ask very specific questions, make very specific observations about the ways in which your brain is working, the types of things you're feeling, the ways you're behaving, even physical symptoms that may manifest. And here they'd be able to apply some sort of a diagnostic label to that set of experiences, that collection of symptoms, right? And so that's where we get terms like major depressive disorder, schizophrenia, bipolar disorder, generalized anxiety disorder, PTSD, you name it. There's literally a book, it's about this thick, full of different labels we can apply to those collections of symptoms, and we call those mental illnesses, okay? But in between healthy and ill, there's actually a ton of space. And many of us have experienced this place over the last number of years, okay? Specifically in the course of a pandemic that disrupted all of our lives in really awful, terrible, and unhealthy ways. But you may have heard the word languishing, and that's kind of what this is all about. You're not exactly healthy, you're not exactly ill, but you're somewhere in between, and it sucks. And so in this continuum model, they've used two words, reacting, okay? And that's what I like to describe kind of as your stress response, all right? And so many of us know what our stress response looks like, right? And it's different for every one of us, but maybe we're nervous, we're irritable, we're a little sad, we're distracted, we have a sleepless night, maybe we're a little quieter, maybe we don't reach out to our friends or family as much, right? That stress response that in some ways we all know and is very familiar. And that's here because it's also important to recognize that stress of just about any kind is something that actually impacts our mental health. Right? When you're stressed because of your family, because of your work, because of, I don't know, because of your dog misbehaving, I don't know, stress, right? We all experience it, and it pushes us outside of that healthy zone. The injured zone, I like to think of as it's your stress response, but it's magnified and you haven't been able to sort of wrangle it in or control it, right? So that's where irritability could become anger. A little bit of sadness might become a really pervasive negative attitude. Being a little bit distracted sort of becomes having difficulty concentrating or focusing, right? But again, not to the point where a doctor, psychologist, a psychiatrist would say you're diagnosably ill. So all this to say, there's a lot of space between healthy and ill. And many of us, many of your team members, many of your employees have found themselves there. And each of us finds ourselves at somewhere at some place on this spectrum every single day of our lives, okay? And it's natural to sort of move around, and our mental health fluctuates, and all of those things. So in terms of what's important here for you is to understand that, to help support somebody in that acute ill zone, that unmanaged illness zone, is going to take more than 45 minutes for me to teach you how to do. In fact, it's probably going to take more than 2 days. In fact, people go to school for years to learn how to do that really well. Okay, so that's not necessarily your role, although it's helpful to understand where to go for help, and we'll talk about that in a little bit. But where you have a really great opportunity in a workplace is particularly in that middle zone, to be able to identify when someone has slipped out of that healthy zone, when they might be struggling, and when they might benefit from support to help them bounce back towards that healthy zone. Okay, so the sooner you can identify when someone's experiencing something that's challenging their mental health, the sooner you can provide support, the sooner they're going to start to feel better, and the sooner they're going to stay fully productive and engaged in the workplace, which at the end of the day is what, of course, we're trying to achieve as businesses. We want employees that are healthy, because if they're healthy, it means they're productive, and that means business works, right? So if we think about then what is your role in all of this, I think it's important to understand what is your job in the workplace as a leader, and then most importantly, what is not your job. So many of you said boundaries was one of your main concerns. And that comes down to not just what do I say and how do I say it, but also what is my job and what isn't, okay? And so here's a few thoughts that'll help us frame the rest of our conversation around how do we actually do this. So what is your job? I would certainly suggest that creating a safe environment to talk about mental health is part of your job. And not that it's written in anyone's job description, but it's really only a job that leaders at any level in the workplace can do. Research, sort of public opinion research from workplaces across Canada and the US says this loud and clear, that employees want to be able to talk about this stuff at work, but they're waiting for their bosses to do it first. Okay, they're waiting for their bosses to send a signal to say it's okay to talk about it. So definitely part of your job. It is your job to engage as a collaborator and as a partner. Initially, when employees are struggling, it's a bit of an opportunity to take off that authoritarian boss hat. And we'll talk about the right approach there. It is your job to recognize and respond to mental health issues. And I say this here because many of us, especially if we have some experience on the HR side of a business, know that it is certainly our job to accommodate any kind of disability in the workplace, right? And that includes mental health related disability, okay? It's absolutely our job to accommodate, but it is also, employers have a duty to inquire, okay? So when an employer has a reasonable suspicion that somebody's experiencing that kind of a disability, they actually have a duty to ask, okay? So that's why this idea of recognizing when someone's struggling is important. Now, it's not necessarily going to be tested in a court of law in every situation, so I don't want to scare you with that, but it is, I think, a part of your ethical responsibility. It is also your job to direct employees to support. And at the end of the day, and this is where it gets really tough, and we'll talk about boundaries again, it is ultimately your job, whether you like it or not, to balance the responsibility on both sides of the table between employees and employers. Okay, so as a leader at any level, you, in most cases, are the interface between the company and an employee. And when someone's struggling, there's responsibilities on both sides. And you have, to a degree, the difficult task of finding that right balance. And it can be difficult. And so we're going to give you some tips around how to do that. It is not your job, though. Here's where it's really important. It's not your job to diagnose or label mental health problems. You don't need to know anything about depression, anxiety, schizophrenia, PTSD, you name it, okay? Not your job. Leave that to the medical professionals. It's also not your job to be a constant source of emotional support or validation. And so I've spoken with leaders who have employees that are struggling, and they've had many conversations to support employees who are struggling. And they find that employees come back to them over and over and over and over again and use them as a pseudo counselor. And that's a really challenging position to find yourself in. It's not your job to do that. It's your job to care and have a supporting conversation. But beyond that, it's your job to be a connector to the right kind of support. In that vein, it's not your job to learn to be a therapist or a counselor. Okay. I don't want to teach you how to be one of those. And it's not your job ultimately to reduce overall accountability on an employee. And here's where it gets, really important. Obviously, we're going to accommodate employees that need accommodation, for example. We're going to provide support that employees need. But at the end of the day, it is a fair and valid truth that there is a job to get done. And employees and leaders need to work together to make sure that job gets done. The job still needs to get done, okay? So there's often a concern, and I work with all sorts of clients, that if we're going to start supporting mental health, we're going to start creating a huggy bear workplace where nobody gets any work done. That's not the truth. And in fact, if you're doing an effective job of supporting mental health, it keeps people healthy, keeps them performing at work, you're going to get more done. Okay. And I know organizations that have seen that benefit quite significantly. And then finally, it's not your job to figure it out on your own. And so this is one avenue for support to help you figure these things out. There are many others, and I'm sure Megan is able to talk about a few of those down the line. So then at the end of the day, how do we do this? Let's get into the how. I know that's why we're all here, the nitty gritty. So 3 R's. Okay. I'm going to make it simple. Three things. And this is how you effectively manage mental health at work. And so this takes everything that we talked about before in terms of the role of a leader. And we talked about the challenges around boundaries, especially in the workplace. And we're going to condense it down to basically these 3 tasks. If you do these 3 things well, you're doing your job. Okay. So 3 R's are number 1, recognize. Okay. So I've talked about this already. How do you recognize signs of poor mental health? Number 2, respond. So how do you open up a conversation with someone? Okay. How do you ask them about what they're experiencing, listen, and problem solve whatever their challenge is together? And then the 3rd R is reconnect, or connect and reconnect, as I like to say. And your job is to connect them to the right kinds of supports in the workplace or maybe outside of the workplace, and make sure you follow up. So we're going to dive into each one of these in a little bit more detail. I'm going to share with you some really practical examples. I'm going to get you to do a little bit of reflecting as well. And then once we've covered all of this off, we're going to talk about how do you do this in a way that's more preventative? What are the strategies you can use as a leader before somebody slides out of that healthy zone to help make it a little bit easier to bounce back? So first one is recognize, okay? And so here we're at this classic challenge. How do I know when an employee is having a challenge with their mental health? What in the world do I look for? What in the world should I be paying attention to? How in the world do I do this in a way that doesn't feel intrusive, that I'm spying on people, that I'm paying attention to their every single move and every single word in conversation? Okay. And so, while you're not a clinician, you're not a mental health professional, my job is not to train you to be one. There are ways that you can sort of spot when somebody is more likely to be struggling with a mental health issue. And it involves really just looking for behavioral change. Okay. Changes in the way people are acting at work. It's as simple as that. And I encourage leaders to look for change across basically 3 areas, 3 dimensions of human behavior, right? Social, so how we're engaging with other people. Affective, and so that basically says, how are people displaying outwardly the emotions that they might be feeling inside? Okay, so how are we expressing or displaying the things that we're feeling? And then the 3rd is performance. Okay, and so if we recognize and understand that mental health challenges affect our whole body, but in particular our brain, and a lot of the work that we're doing, especially in the construction industry, is brain-based work. There's obviously an element of manual work to it, but it requires a fair bit of intensive thought and cognitive function. Okay, so if we accept that's the case, then obviously if someone's struggling with their mental health, we're going to see a dip in their performance. Okay, and so here's an example, and admittedly a bit tongue-in-cheek. So I've had leaders ask me, Jordan, can you teach me all about major depressive disorder, for example, okay, depression? I'd really like to know. I feel like if I knew what the signs were, what the symptoms were, that I would be better equipped to spot it in the workplace. And I say, sure, here's what it's all about, okay? And so I'm a health professional. I know a lot about this type of thing, in particular depression. And so I'll say, when someone's experiencing depression, They'll feel worthless and helpless. They'll have frequent negative thoughts, a poor mood that is persistent and pervasive. They'll experience changes in their motivation. They'll experience changes in their appetite. They'll likely experience changes in their sleeping patterns. And heck, they might even experience changes in their libido. But dear goodness, if you're a supervisor or leader in any workplace and you happen to know firsthand that an employee is experiencing changes in their libido, it's probably a different conversation we need to have, and it's probably going to involve someone from HR, okay? So all that to say, those clinical indicators, the clinical symptoms aren't anything that you need to worry about or necessarily know about because you can't really directly observe them in the workplace. Let's take a different example, someone who's maybe experiencing an anxiety disorder, or maybe even just a greater degree of worry or anxiety in their day-to-day life. What they're likely experiencing are repetitive thoughts that are running over and over and over and over in their brain. They're usually negative, okay? And it's like a bit of a hamster wheel. And so as a mental health professional, I'm trained to ask people very specific questions, listen to how they respond, and be able to ascertain some understanding of what that hamster wheel looks like in their brain. You're not trained to do that. That's okay. But what you might see on the outside, if that hamster wheel is running, is someone having difficulty paying attention, someone having difficulty remembering what you've just said to them, for example, someone forgetting what they climbed down the ladder for, as an example, right? So you can see the outward stuff. You can't necessarily see what's going on inside. And so a couple common signs of struggle, and this comes from actually some research in Canada and a man named Kevin Kellaway. And basically he's asked leaders to help identify or sort of polled leaders, say, what are the first things you notice? What are the things, in hindsight that sort of signaled to you that there was a problem with someone's mental health? And here's a few signs. So these are things you can pay attention to, sort of more concrete behavioral changes, right? Withdrawal or isolation is a very common one. So when someone's struggling with their mental health, they might be quieter, they might be less conversational. Some of the social norms that we develop in teams, whether it's how and when we have our coffee, what we talk about on Monday morning, for example, they maybe just stop engaging in those kinds of behaviors. You may see emotional outbursts, things like anger, even tears, and those are obvious, more obvious signs. As I mentioned off the top, you'll likely see changes in their attendance, right? So we could say absenteeism, maybe they're calling in sick, maybe they're showing up late, maybe they're leaving early. You could see extreme behavior, so certainly beyond emotional outbursts. You could see, for example, people appearing to come to the workplace intoxicated, or you could see signs of self-injury, for example. You might also, and then I think the final thing would be you'd certainly see reduced performance. So these are some of the things to pay attention to. This is not an exhaustive list. And Norman, great question. Where does being forgetful fall under the list of common signs? I would say being forgetful is probably common, although less obvious. I haven't included in this specific list of 5, but certainly it would make sense. We'd fall under probably the performance aspect of things, right? Because it's going to affect the way that we're able to perform at work and do our work. And so the important thing, though, is just because someone's forgetful doesn't mean they're experiencing a challenge with their mental health, right? I could usually be very forgetful, and that's just me. Right. And if you were to ask my wife, that is exactly what she would say. Jordan is always very forgetful. That has always been the case. That is never likely to change. And so what you want to pay attention to is when these things come up as marked changes from what you understand to be someone's usual or typical behavior. Okay. And a good way to think about this, and I'll likely throw it in the chat, is to look at intensity, duration, and impact. Okay, are kind of the 3 things you want to be paying attention to. So intensity, is this change that I've noticed a very significant departure from their usual or typical behavior in the workplace? Okay, that's question number 1. Number 2, duration. Is this more than 1 day, for example? Is this a bad day, or has this change been happening now for a number of days, even a week or even 2? Okay. A good guideline is if you notice that substantial change for more than a handful of days, good opportunity to have a conversation with someone and inquire, okay? And then impact, okay? and this is the last one, is to say, is the change you've noticed affecting some material aspect of their work or their ability to function at work? Okay. And if the answer to all three of those questions is yes, then it's important for you to reach out and to have a conversation with the employee who may be struggling with a mental health issue. And I say may very intentionally, because they may actually be fine, but you won't know until you ask. Okay, so it's important to use that as a sign to open up a conversation. You're not saying Jordan definitely has depression because X, Y, and Z, but I'm saying it's time to have a conversation about it, in particular because it is affecting some aspect of their ability to function at work. Okay, so I'll maybe just throw it back to you in our group here today, and just ask, as you think about everything that I've just said, what are the behavior changes someone might notice in you? We don't have our employees in front of us, although certainly I'd encourage you to think about what you may have seen, or even past things you may have seen and changes. But let's just think about ourselves momentarily, right? If we were experiencing a really stressful event, okay, what might our supervisor, our boss, notice in us at work? Okay. So for me, and feel free to throw it in the chat, I'd love to see even just a few examples and invite you to reflect. For me, a couple things that would come to mind that would be observable outwardly, right? So my leader would probably notice a quieter during meetings, for example, or when we're trying to make decisions. I'm less participatory. So that would be an outward observable thing for sure. They would probably also notice or hear more skepticism or pessimism from me, right? So that's an important one. They would also probably notice procrastination. And that's what comes out in me when I'm feeling an incredible amount of stress, is procrastination, right? And so I see a number of responses coming in, and this is fantastic. So the key takeaway as you're thinking and then even reading through some of these responses, also to understand that this is different for everyone. Okay. And so as a leader at any level in the workplace, it's important for you to take the time to get to know your people so that you're better equipped to understand what is or is not their usual behavior. Okay. So that's maybe the call to action here for you, is to take the time to get to know your people, because if you don't know your people, you're not going to be able to spot these changes. So a few comments I'll make. I see many people, quieter, a few people saying their mood changes or moody. I guess what I'd encourage you to think about is, what would that look like to someone who's not you, who doesn't know what your mood is, right? What would that look like on the outside? But I see a few people saying yes, procrastination, less patience, getting quieter, not being able to concentrate, be emotional, for example, a decline in hygiene. That's another interesting one, and can certainly be common as well. So key takeaway here is that you're looking for change. Intensity, duration, and impact is what you're looking for. And if you see those changes, then my advice and encouragement is to start having a conversation with someone about it. Okay, so now we're going to go into how you can have that conversation, and then finally, what kind of supports you can connect someone with if they need them. I see a few more responses coming in. This is fantastic. Feel free to keep reflecting on this and sharing. I think, in Mental Health Week, and I didn't talk about this at the front end, this is also Canada's Mental Health Week this week. And this is day number 2. But the theme for this year is my story. Okay. And I think it just prompts us to understand that each and every one of us has a story of some sort as it relates to our mental health, right? Not all of us have experienced major depressive disorder or PTSD or illnesses like that, but every one of us knows what it's like to struggle with our mental health. And all of you have just described aspects of that experience. So I want to thank you for sharing that, and maybe a good prompt to kind of reflect on some of that over the course of this week. So, then the question is, if you notice these changes, and Warren, I'll just highlight as well your comment in the chat, felt very distracted, unproductive. It was a terrible experience. Yeah, it sucks. It really does. And maybe that also illustrates the fact that, that if somebody's struggling, and maybe they're less productive, they're unable to concentrate, they're distracted, all these things, it's not likely because they don't want to work, right? It's not likely because they're just a poor performer. I think, Warren, your comment really illustrates that it's not a fun experience. As human beings, we are generally motivated to be productive. It's how we survive. It's how we built cities. It's how humanity has evolved for millions of years, right? We have that internal drive. And so it's not only frustrating for you, perhaps as an employer, it's also potentially really frustrating for that employee who's struggling too. So it's really an opportunity to actually support them, and it'd be a win-win for everyone. So then the second component here is respond. Is how do you respond? Warren, thank you for sharing. A very bad event is what you witnessed and kind of triggered that. And absolutely that can. And so I will say as well, and this is a bit of a different tangent, but when this kind of support is most important, it's important all the time, but when it's most important is after significant incidents, accidents, that kind of thing, is where your team members are more likely to need this kind of support from you as a supervisor or a leader. So when these things happen, and though of course we don't want them to, it's important for you to pay attention and look at some of those changes and be prepared to have this conversation and offer support. So how do you have this conversation? And really quickly, I can't give you a script, but essentially there's 3 key ingredients that need to be in a conversation with someone who's struggling in the workplace. Okay, support, empathy, and truth. And if you can convey these 3 ingredients, these 3 concepts in a conversation, you're going to be able to demonstrate that you're concerned, that you care, that you're concerned, and you'll also be able to sort of stay focused on the fact that we're in the workplace and there is still work that needs to get done. And my job is to help you figure out how we can do that. Okay, so support is really about a simple statement that describes the change you've noticed, the fact that you care, and that you want to know more. Okay, so hey, I'm here to support you. Anything going on that you want to talk about? And so a nice way to frame this, and an example that I'll use is, for example, I've noticed you're more irritable lately and shouting at others. Okay, I'm concerned about you. How are you doing? I've noticed, I care, and then I'm here to listen. Is really what you want to convey here. Okay, I've noticed, I care, and then offer them an opportunity to share from their perspective. The second key ingredient is empathy, and provided they take you up on the opportunity to talk about the thing that you've noticed, this is a great opportunity for you to demonstrate that you can listen really well to what someone's saying. And when someone's struggling, the primary, well, not necessarily the primary, one of the primary things they may be experiencing is a sense that nobody cares. And so even the fact that you said, I've noticed, actually conveys a sense of care right there, right? Like, I care enough that I'm paying attention to you. And that can be really powerful for an employee. But provided they take you up on the opportunity, empathy is really about listening and conveying your understanding of what they might be going through, okay? And so a simple formula for empathy, and we won't get into it in a great deal, but it basically involves naming a feeling. That's it. That's the primary way we can demonstrate empathy, just simply naming what someone's feeling. So it sounds like you're feeling upset because of the way your coworkers are treating you, as one example, okay? And so most of us would benefit from building our emotional vocabulary. We grow up and as young people, we have basically 3 emotions, right? I've got a toddler at home right now, and basically sad, mad, or glad is really just 3 emotions. And many of us, unfortunately, don't build our emotional vocabulary much beyond that. And so as a leader, if you want to demonstrate empathy really well, it's important to build your emotional vocabulary or your emotional literacy. But if they decide to share and open up, empathy is key. And so basically naming how they're feeling and doing a bit of active listening is the second key ingredient. And then the third key ingredient here is truth. And so this is about bringing it back to the impact in the workplace and the fact that there is a change that needs to happen, right? And that change could be many different things depending on what you've noticed. But obviously, what you've noticed is having an impact on their ability to do work. And so it's important to bring it back to what that impact is, and then offer to be a part of the solution with them. Okay. So for example, we need everyone to be respectful at work. That's just the truth. Okay. No matter what can I do to make it easier for you to keep your cool? How can I help you do that? What could you need from me to help make that easier for you? What kind of support would be helpful? Okay. So support, empathy, truth. If you can have a conversation with an employee that has those 3 ingredients, you're much more likely to demonstrate that you care and lead to a successful outcome. And that would be that you can then start to think about solutions with them. What exactly do you need? What can I do differently? What might you need to do differently? Are there other supports that we need to get you connected with? Okay. And that gets us into our third R, which is connect and reconnect. Okay. So your role beyond recognizing someone struggling, having this supportive conversation with them, and then perhaps offering some support in terms of how you might change the way you're managing, leading, supervising them. Outside of those things, your job is to be a connector. And it's really important because if we look at a concept called resilience, and it's a word many of you have likely heard over the last number of years, and we're kind of admittedly tired of it. I'm tired of being resilient. But if we're tired of being resilient, it probably means we don't quite understand what resilience is all about. If we look at research from individuals that have described massive disasters, earthquakes, hurricanes, you name it, okay? The thing that actually makes people resilient, that gives them the best psychological outcomes, is their ability to build and use a network of social support around them, right? So it has nothing to do with our own mindset or persistence or grit. It actually has to do with our ability to connect and seek support from other human beings. And that's the foundation of our resilience. So that's why connecting an employee to other supports is such an important part of your role, because it's actually building their resilience. And so if we think about support in the workplace, there are a number of different options. And if you remember that mental health continuum from the front end, I like to think about support in the workplace kind of along a similar continuum, okay? So in that healthy zone, or maybe in that reacting zone, the kinds of things that are most likely to be helpful in the workplace are some changes perhaps in the way that you're providing management, supervision, or direction. Maybe it's a little more flexibility. Maybe it's more regular feedback. Maybe it's writing things down instead of articulating them verbally, for example. Support from colleagues, right? And that's very practical support. It can be as simple as getting someone to help on a very challenging task that feels overwhelming, okay? From there, things like wellness information, right? Here's how you can take care of yourself. Here's, here are some tips for better sleep, for example. And then we move up in terms of intensity. This is where if you have an employee assistance program, it's a good place to think about it. Time away from work can be helpful if that's an option for employees. Psychological services, so speaking to a psychologist, a psychiatrist. And then from there, accommodation. So if somebody has in fact been diagnosed with an illness that needs to be accommodated. And then finally, disability leave. And I place it here not because it is in fact a support. I think it's important for us to remember that. If someone's away on disability leave, or as some would call it, stress leave, it's typically because it's the kind of support that they need. And it is, ideally, it's something we can avoid if we're good at identifying when people are struggling and jumping in sooner. But we can't do that in every situation, in every instance. We're never going to be perfect. So it's important to recognize that as a support. So even if you before entering a conversation, take a few moments to understand where might an employee be along that mental health continuum. It might help you make a better judgment of the kind of support they may need from you or from the workplace. And then the last piece here is around reconnecting. Okay, so connect and reconnect. And so I always say, don't let the first conversation about mental health be the last. So ask the question, when are we going to talk about this again? And so it demonstrates that you care and there's some accountability on your part. It also makes them more likely to perhaps do things that are going to be good for their mental health outside of the workplace. And it's an opportunity to reassess the situation and explore additional supports if needed. So 3 R's for managing mental health at work: recognize, respond, and reconnect. Okay, so you're going to get a copy of these slides. My hope is that that's a useful framework for you. In the last couple of minutes, I want to talk about what can we do as leaders that's more proactive. And so in most safety programs, right, we're talking about reducing or eliminating hazards. And the closer we can do that, the closer we can do that to the source of the hazard, the better, right? Yeah, many of you are familiar with that hierarchy of controls, right? So ideally, we want to eliminate hazards from our work. And if we can't, at the bare minimum, we want to give people the personal protective equipment that they need. And so what we've just talked about, how to recognize and respond when someone's struggling in the workplace, is an example closer akin to personal protective equipment, right? So someone has been injured, as an example, and we are reaching out to provide a form of first aid, right? But what can we do in our workplaces to make it less likely that people are going to get injured? That's a great question. And now, of course, people don't just exist in workplaces, right? They have personal lives and home lives and other circumstances that they carry with them, and those are out of our control. But what is in our control is the work environment we create for our people. And so really quickly, I want to just provide you with a few things to think about in terms of how you, as a leader at any level, and if you happen to be a very senior leader in a construction organization, there's, I think, some important considerations for you. But at any level, what are the things you can do to help make an environment that supports people's mental health and is closer to that elimination in our hierarchy of controls? And so the first concept I want to expose you to is something called workplace factors for psychological health and safety. So many of you may know, and some of you may not, but Canada actually has a national standard on psychological health and safety in the workplace. It was developed by the Canadian Standards Association with support from a few other organizations. It's maintained and is CSA Z1003. It's free. You can download it. It's a voluntary standard at this point. So there's no requirement for any industry, any organization to implement it. But within that standard, one useful concept is the idea of workplace factors. And we all know, if we think about that hierarchy of controls, that there are different risks in any workplace. And we think about them often very physically, right? Trips, falls, et cetera. But from a mental health lens or a psychological health lens, there are different kinds of risks in the workplace. And we see examples here. And so, for example, a workplace that is not civil and respectful places workers at risk for challenges with their mental health. A workplace where employees are not involved in decisions that influence their work puts them at greater risk. Workplaces that do not effectively manage employee workload puts them greater at risk, specifically for things like burnout. For everyone that's interested in that standard, just a quick request for the number. Just put that into the chat. So just let me know that you can see it, but CSA Z1003. And so from a proactive lens, the standard actually suggests that workplaces do a fairly robust assessment for these kinds of factors, okay? So what are the specific psychological risks that are present in your workplace? And then take specific action to mitigate those risks, right? So civility and respect is one great example, and relatively easy to a degree because we have legislation around respectful workplaces, but others are a little bit harder. That being said, each and every one of these is something that, you know, in any business, you're probably already talking about, right? So not only are these things, you know, good for retention and attraction of employees, they're also good things to make sure you're on top of from the perspective of minimizing risk for harm in the workplace. So I'm not going to talk about this in any greater detail, but for those of you that are interested, go and check out Canada's National Standard for Psychological Health and Safety. It's about developing a management system for mental health in the workplace, and is a really interesting concept that many organizations are embracing all over the country, and in fact, internationally as well. So started in Canada, and now it's moved to Australia, and all over the world, there's an ISO guideline. And in Australia in particular, interesting to understand that there's now legislation that requires this type of risk assessment in just about every workplace. Okay, so they're a little bit ahead of the curve. But if you look 10 years into the future, it's conceivable that something like that may in fact be mandatory in Canada. And then the last piece I'll leave you with, and then I'll turn it over to Megan, who wants to kind of tee up some additional content for the week. It's just around specific behaviors for leaders. At the end of the day, effective management for mental health is just simply effective management. All of the best practices in leadership also actually support the mental health and well-being of your people. So a few suggestions from Jordan. Number one is support, don't solve, especially when we're talking about employees who are struggling with a mental health challenge. Those are big challenges often related to perhaps big life circumstances, big health issues, you're never going to be able to fix it. So the more that you can approach those situations, understanding that your role is to support them, to connect them, the more successful you're going to be. Don't try to immediately offer an advice, offer a solution. Be a good listener first. And that's maybe the one of the biggest for me. Tone from the top is important. So I mentioned earlier on that employees want to talk about mental health. They want their leaders to take the lead. And so this is not to say if you've experienced a significant challenge, you need to spill the gory details to everyone you work with. But even conversations around stress in the workplace can help normalize the fact that it's okay to talk about this stuff. We don't have to make a big deal out of it all the time. But the more we talk about it, the more we ensure it's part of our culture as an organization, that we can talk about the hard stuff. We can talk about it as human beings. It's going to make it easier when people do need support to have that more intentional conversation. Outside of that, autonomy is also really key. So we know that control in the context of work environment is good for people's mental health. The more control we have over our work, the less likely it is to affect us negatively. So as leaders, the more you can allow people to be autonomous, give them the freedom to make decisions, give them the freedom to do the work the way that is going to work best for them, provided, of course, that it meets all of your regulations and safety requirements, all that kind of thing, right? But the more flexible you can be, the better. Create safety in teams. And so there's a concept, it's called psychological safety, which is different from what the standard talks about. But essentially, if everyone feels included, that they know each other in their team, that their team works well together, right? That's also really protective for our mental health. So the more you can focus on actually building a strong team, the better chance you are going to have of making a positive impact. And then final tip for you as leaders, just model healthy habits. Although we would love to say that all humans are autonomous and make their own decisions and all that kind of stuff, ultimately in a workplace, most of us are going to do what we see our leaders doing. And so maybe just a call to action for all of you as leaders to say, it is Mental Health Week. And this would be an important week if you're going to think about, how do I look after myself, to do something that's good for you, and even talk about it with your team, with your people in the work environment, start to role model what it looks like to actually look after ourselves. So with that, I'm going to turn it back over to Megan for a little bit. This is my contact information. I'd be more than welcome to carry on the conversation. And I want to thank all of you for making time to be here today. So with that, Megan, I will turn it over to you, and thank you again for the opportunity to be here with all of these fine folks today.
Wonderful. Thank you very much, Jordan. That was an excellent presentation, and I think you left us with a great call to action. So thank you very, very much, Jordan. Before Jordan steps away, there are a couple items that I wanted to highlight, but I also want to give people opportunity to ask Jordan any questions that they might have from his presentation this morning. You're welcome to put that into the chat for the next couple minutes, and Jordan can help answer those questions for you. While you are thinking of those questions to ask and put them in the chat, I just wanted to highlight a couple things that you're kind of scrolling on the screen right now. So we have a training day coming up in Brandon on June 22nd. So our Westman training day on June 22nd. So if you're in the Westman region nearing Brandon area, mark that in your calendar. You can use that QR code on the screen, as well as head to our website for further information about the training courses that we are going to be offering that day. The next thing I just want to highlight is our CSAM app. If you do not currently have that on your mobile device, please download it. It is free, and it has a lot of great content, as well as access to the legislation. In basically wherever you have your phone, you will have the legislation, which is a great resource to have at all times. Also head to our website to look at information that we have and events that are coming up in Manitoba in the safety scene. So it's a calendar of events that are coming up, and you can take a look at it there. And last but not least, I also want to highlight that we do have 2 more webinars scheduled this week. We have our Harassment is More Than Just a Policy that's coming up tomorrow. So that's with Wendy Hofford. as well as on Thursday, we have Randy from Protelic speaking on lone worker safety. So if you have already registered for those events, you should have received an invitation with the link to the Zoom account. If you haven't registered, please do so from using that same link as you did for today's event, and I'll send through that link to the Zoom account later today or tomorrow whenever I receive that registration. Another couple questions that I'm seeing that coming through, and maybe they're directly to Jordan. Will this session be available to view at a later time? So yes, we have recorded this webinar, so it will be made available. So we will likely put a link to it through our website and on our YouTube channel. And we do have Jordan's presentation, the slides of his presentation available as well. So everyone that's registered for today's webinar will receive that presentation in their email account. So you can watch out for that. Otherwise, does anyone have any questions to ask Jordan? Looks like no other questions are coming your way, Jordan. Do you have any last comments?
That either means I've done a really good job or a really terrible job. So no, I mean, I'll just say thanks for taking the time, everyone. It's Mental Health Week. It's an important topic this week, but it's an important topic every day of the year. And so I just want to say thanks. And Megan, again, thank you for the opportunity to be here. Really appreciate it.
Wonderful. I appreciate this time that you've taken with us, Jordan. Thank you all for attending this afternoon in your lunch hour. Have a great day, and hopefully most of you will continue to join us tomorrow. Thanks very much, Jordan. Take care. Bye-bye.